name's Aideen Maguire. I'm a lecturer in epidemiology and an MRC Skills Development Fellow in the Centre for Public Health at Queen's University in Belfast. My research focuses on population mental health. So Northern Ireland consistently has worse mental health compared to the rest of the UK and Ireland. And we also have the highest rate of death by suicide. So it's vitally important to understand what causes poor mental health in the population so that we can work to prevent it. I'm a psychologist by training, and the more I learned about mental illness, the more I realised that we actually know very little about what causes mental ill health, especially common mood disorders such as depression and anxiety, which are the most prevalent in society and those that contribute most to disability-adjusted life years lost. So to understand any disease, you have to go back to basic epidemiology, to look at the disease population and those without the disease, to try and determine what causes the disease in this population. But in terms of mental health, this is quite difficult because there are no registers of mental illness. And this is when I came up with the idea of using administrative data. So to use already existing administrative data to identify individuals who have mental illness, looking at things like prescription medication record, hospital records, and death records. To understand the determinants of mental ill health, the trajectories of mental ill health, and to target interventions. The UK CRC Centre of Excellence has offered me a range of things: support, space, and a social network. Support in terms of practical support. I completed my PhD within the Centre of Excellence in 2012, and throughout that time the Centre really promoted attendance at a range of training courses and really supported training early career researchers. Space in terms of, in 2014 I secured a 5-year postdoctoral post. And this is a very rare thing. The Centre of Excellence had the foresight to invest in long-term postdoc posts, which gave me the space to develop my research ideas, to apply for grants, and eventually secure an MRC fellowship. And in terms of the social network, not only here within Queen's, but also the wider UK CRC network, and the annual conferences that we attended, helped me build a range of collaborators, mentors, locally, nationally, and internationally. Very rarely do a group of individuals who are passionate and like-minded come together in a way that is truly collaborative and truly supportive of each other, like we do in the Centre of Excellence. The greatest legacy, I think, of the Centre of Excellence are the early career researchers, some of whom are just completing their PhDs, others in postdoc posts or early in their lectureship careers. And these individuals have benefited from the enthusiasm and passion throughout the Centre of Excellence tenure, and continue to promote that in their own work.